Hi everybody, it's Dr. Linda of the Vascular Birthmarks Foundation, live from New York City for our April 2025 VBF Facebook Live with world-renowned port wine stain and infantile hemangioma expert Dr. Gregory Levitin of New York City. Welcome, Dr. Levitin.
Thank you. Happy to be here.
And guess what May is? What is it?
I believe there's a special date coming up this month.
Yes, May is the VBF International Month of Awareness, and we ask all birthmark groups around the world to join us raising awareness for what we call all VBARs, vascular birthmarks, anomalies, and related syndromes. And you've joined us every year by putting on your birthmark on May 15th. So stay tuned for more announcements. So we're here for 1 hour. I'm just checking to make sure Dr. Levitin and I are visible on the screen, and send us your little thumbs up so we can see that we're live. Let me just get
We got our first comments that we're live.
Great.
Yeah.
Great. I know to see it on here. See, I see it. Awesome. And we, yes, here we are. We got our first comment, and that's from 𝗟𝗲𝗃𝗁. Hello, Tara. Let me just make sure the sound is off. Hi, everybody that's on. Everybody's joining. Remember, we have Dr. Levitin for only 1 hour, so ask your questions as soon as you can. I just want to get you in there more. Okay, good. All right, so hello from Kiana saying hi to you, and Jim Kelly, hi Jim, and Trevor, hi Trevor Van. Remember, May is the VBF Month of Awareness, and if you want to see Dr. Levitin in person, he will be at our October 10th and 11th Super Clinic here in Manhattan, and he'll be on the team with Dr. 𝗟𝗏𝗃𝗁 and Dr. Darrow on our surgical team, and we have lectures on Friday and the clinic on Saturday. Check out our website at birthmark.org if you want to register and come for free consultation, free laser. This year we're adding free glaucoma checks with a doctor from NYU, Dr. 𝗟𝗏𝗃𝗁. I'm so excited.
Yeah.
You know him, he's great, right?
Yeah, great
So
reputation.
we just got him added as an expert, so he'll be able to do pre-screenings in the babies for glaucoma with 𝗟𝗏𝗃𝗁.
Yep, and so it also just increases awareness because glaucoma is like one of those hidden parts of 𝗟𝗏𝗃𝗁 syndrome. And it really takes a specialist who understands the relationship of port wine stains and the way it invades deeper into the body. And to have a port wine expert who focuses on glaucoma is really an important addition for the VBF. That's great.
Amen. So let's get your questions. Everybody's on saying hi. Marguerite Bradley's on. Taylor Gordon's on. Poppy is on.
I want to say hi to Teresa. That's
Yes,
a
and
blast from my past. Right
Poppy is saying hi, hello from Greece to you. So hello, Greece.
Yeah.
Remember,
We're international. Yeah.
Yes, we are international. Ria's on. Hi, Ria. Everybody's starting to get on now. Yes, you made it. Yes, everybody's like, you made it. So let's start with any questions, any new developments. If you haven't been here, Dr. Levitin has a new office. It's absolutely beautiful. He sees babies with birthmarks here, adults. You do laser, you do debulkings for the lip.
Yep. So for the new office, we have something where we are able to provide same-day, next-day care. A lot of times people are, with a baby that's born, they don't know where to go. So we also, we have a call center that, helps to forward these babies into treatment as early as possible. Dr. 𝗟𝗏𝗃𝗁 was one of the early proponents of that with early laser treatment, because a lot of these times, we all hear this story. I had a patient even just today, beautiful 12-month-old baby, and they talked about how it started just as a little dot, and now it's it's the size of half an egg on the side of the head, but they didn't see anyone sooner. So we always say there's a window of opportunity as early as possible. If treatment's possible, we want to get that done in the first weeks and even the first few months of life. That goes for both hemangiomas and for port wine stains. And the real important thing is to have a specialist see them. And Dr. Linda was very influential with the American Academy of Pediatrics back in 2015, where guidelines were posted to help educate pediatricians, because unfortunately not every hemangioma needs treatment, but the ones that do usually declare themselves between the first and second month. And that's why the guidelines say at the 4-week baby checkup, if there's signs of a vascular birthmark, they should be referred to a vascular birthmark specialist for them to decide if this is one that will need treatment. Because we've all seen the ones that started off as a little cute one, But those cute, I always say every big hemangioma started off as a little hemangioma. So
that's a good, I like that line. Every big hemangioma started off as a little one.
Yep.
And that's a good line for get it, we want to see it when it's the little one.
Yes, you
right?
want to see it as early as possible.
You want to see the little one.
For sure.
And, you know, parents are like they just can't believe that their primary care doctor, their pediatrician doesn't understand these.
Yep.
But this isn't taught in medical school, right? And so
they're taught to make a diagnosis, but it's the management. That's the art of the medicine. That's where the decision making comes in. Are we doing medical therapy? Are we doing laser therapy? Are we doing both laser and medical therapy? And I think that's one of the things that's very challenging is I see patients all the time who've been seen by, I'll say, very good doctors, but I really feel like they're holding one arm behind their back. They do one or the other, when in fact, we all know now from our history and our studies that oftentimes treating medicine and laser at the same time, propranolol and laser for these early hemangiomas, can greatly influence the future outcome, meaning that we can do less laser and less time on medicine when we do them together. That's, I think, one of the learning lessons.
I love that. I love that combo. And I tell a lot of parents that I refer to you that you have that 1-2 punch where you will be lasering and maybe even using the topical timolol, and that if we get them early, we can just knock it right out.
It's amazing. Like I said, you know, the difference of seeing someone at age 2 or 3 months versus 6 to 9 months, even though that's still early, is very dramatic because the life cycle of a hemangioma is really over 9 to 12 months, which means a lot of the growth occurs in the first 3 months, and the last of the growth occurs between 3 and 9 months. So when as early as you can in that growth cycle, you can greatly influence the direction it's going to take.
Your friend Alicia is saying hi. She's been recently back from Italy and
Alicia
doing great.
is a miracle case where Dr. 𝗚𝗃𝗏𝗃 was able to provide incredible care for her AVM, and I'm sure she'll be sharing that with the community as well, because we're all very happy for her as well.
Yes, ecstatic. So we have a shout out to you from Matt from Portugal, and a shout out to you from 𝗧cie𝗽𝗶𝗰 from Morocco. So you know, it's amazing, right? It's just amazing.
We had a wonderful trip to Lisbon a couple years ago, so I was hello to Portugal.
So Sabrina has the first question for you. Sabrina Blackburn, how much success have you seen in laser treatment on feet?
So I think this is a port wine stain question, and a port wine stain is going to occur anywhere on the body, including the extremities, the hands, and the feet. So I would say is for the cutaneous skin on the top surface of the foot, there is some success with repeated laser treatment, but on the soles of the feet or the soles of the hands, you know, the palm, you know, the part that touches the floor, very little to any treatment can be done there. It's challenging for every patient because gravity just pushes blood into these dilated vessels. And I think that's part of the problem, but also extremities are just very different than the head and neck area, so we don't lump them together. I think each case is individual. I do a lot of extremity work in my office. We have a laser room here in the office with a pulse-side laser, and we'll often just do patch areas and try it, because a lot of times when you're talking about treating extremities, you're talking about treating an extensive area at a time. So we like to do test patches. What that means is you come in, we just, you know, at no charge, we just do 3 to 5 areas of a patchwork, and then just wait a week or two to see if there's any signs of improvement. The ones that we improve with laser are the ones that deserve to go through that 6 to 8 or even 9 or 10 treatments of laser, because we can make a big difference on the ones that respond well. If there's any breakaway areas, meaning that if it's not dense but there's like spotty areas, those also indicate that they do really well. But it's an individualized case. I welcome you to send some photos to me through my website. I'm also one of the birthmark experts on the VBF birthmark.org website. Happy to answer any questions that way.
Thank you for that. And Jim and Kiana are on, and they can share your email that we have right into the discussion chat so people can get it right away. Also, you have a shout out from Ireland. So, and Alicia wants you to know, but I love you more than Dr. 𝗚𝗃𝗏𝗃. I love our patients so much, right? I just love them. We love you, Alicia.
I've known Alicia longer than she's known Dr. 𝗚𝗃𝗏𝗃.
That's right. This is true. Like probably almost going on 20 years, maybe.
I think we're in the high teens.
Yeah, high teens, exactly. So we're happy to take your questions, and along with that, along with the lasering of the feet question, I recently heard if you get them in when they're right after birth. And
Oh,
they're-
sure. An early port wine stain is a very different case than an extremity as an adolescent, teenager, or adult. So yes, for port wine stains, this goes whether it be on the head, neck, or body. Early treatment, not only is it more effective, but it's obviously just a smaller area to treat, so it's much easier to treat the entire surface area at that time. And yes, we have seen time and time again the publications that have come out in some of the journals that early treatment makes all the difference, and these are cases that also still require multiple treatments, but the results are sometimes quite extraordinary.
We have a question, thank you for that, from Poppy. Is it safe to do laser on the eyelid? My child is 3 years old, and we already do treatments about 3 years, but not on the eyelid.
Sure, this is a common question we get. So the answer is we want to treat the areas inside the eye. So that means the areas around the eyebrow, but inside the eyelids and whatnot. But you need to have special protection or eye shields when you do that. For some adults and even some small children, we put some numbing drops in the eye and then we place a metal shield in there. But for a young child who can't hold still, it can be very uncomfortable. A lot of times we do is we take them to the operating room. We give them just a little gas mask anesthesia to make them go to sleep for 5 minutes. That's when we can safely put in the eye shield, treat the entire area around the eye. The good news is that because the eyelid skin is so thin, it doesn't require as many treatments as other parts of the face or the neck. So again, it may require a couple trips to the operating room to get effective treatment, but we certainly want to give treatment to the entire area. It would not be appropriate to have a clear skin but a bright red eyes.
I tell this story all the time that in some countries, and this country in particular is Israel, they couldn't get the eyelid treated. So Dr. G would have a group of mothers with babies with bull's eyes around show up because he uses the eye shield.
Unfortunately, we've all seen those cases.
A lot of great questions. So Tamara says, my daughter has her second laser treatment at CHOP on the face. She's 3 months old. Her doctor told me that she would need 9 treatments. After those treatments are complete, how often do they need to come back for maintenance?
So the good news is once you've achieved a high rate of success, you don't need to repeat that many treatments. So the answer is you still need to observe closely. If there's signs of darkening, that's the first sign of progression of port wine stains, because if we don't cure them, we just control them for a period of time. So after, let's say, 8 to 10 treatments where you get a desired effect, let's say 80% or even 90% clearance, although occasionally some people think they get 100%, it should last for several months because it's a cycling of blood vessels, the new vessels that come in that dilate, because again, the same vessels have the same condition where they don't stay in a small state, they slowly dilate. So when they start to dilate and that causes darkening of the involved skin, we would want to do 1 or 2 more lasers that following year just to kind of keep it at its current state. So maintenance is kind of an individual thing. It's often a good conversation to have with your doctor in person so they can examine the area involved. But more importantly is I would count on maintenance every 1 or 2 years for typical port wine stains, particularly in growing children, puberty or hormonal changes with women in pregnancy and things like that.
Thank you for that. Melissa has a great question. She's 44 and addressed this. She has a lot of blebs on her face, but she wants to know if she'll get more as she ages.
So
what can you do to treat those?
Sure. So I'm so glad you asked that question. Blebs is one of the things that happens in about 15% of port wine stains, which means all port wine stains cause some darkening and thickening, but the ones that pooch out, they're called blebs, which means you get almost like small mushroom ballooning of the skin because the dermis has lost its elasticity, its integrity, and it breaks, and then the tissues can rise up and cause these little swellings or blebs. Those are often treated with small little local excisions, especially when they stay very small. We do believe that laser treatment can help prevent the progression that leads to blebs, and there are some studies that have shown that even addition of YAG laser or alexandrite laser, things that go a little bit deeper, can also penetrate and cause more control of those vessels at the dermal layer. I think it's, again, one of those things that it's an individualized thing. Not every port wine stain is going to have that effect. Some show up in early life, in the teenage years. I've seen patients who didn't develop blebs until their 40s or 50s. It's an aging-related thing, I think, with skin as it loses its collagen, and we all age medication. But nonetheless, these are the kind of things that prematurely happen, and we want to restore normal contour smoothness. But again, with small little individual surgeries can be really effective.
And I read in a paper on port wines and blips that once you start getting them, it's progressive. They don't ever reverse or...
Yeah, once a bleb happens, it wouldn't go away with just laser. You're really, now you've lost the condition of the skin or the integrity of the skin. You would need to restore that surgically.
Thank you for that. 𝗧cie𝗽𝗶𝗰 says, is it safe to do a mustache transplant on a birthmark area? Mine is covered 1/3 of my mustache and my full right cheek.
So this is such an important question that relates to hair growth in port wines and laser. So I'll say laser does not remove, pulsed laser does not remove hair, but the implantation of the port wine stain vessels occurs at approximately the same level as the hair follicles. So when the port wine stains progress, hypertrophy, and develop, they often squeeze out or lose the blood supply to the hair follicles, and we lose a lot of the hair, and we lose hair density in those areas. YAG laser is a hair removal laser, but we don't usually use YAG laser for port wine stains. We use pulsed laser. Now, in hair-bearing areas, whether it be the eyebrows or mustache, you can put a saline gel, which helps to protect the hair when applying a pulsed laser, because the pulsed laser has cryogen spray. Cryogen, which, as we all know, Dr. Nelson and his team helped develop many, many years ago, is what provides safety for laser treatment so that we don't burn the skin. But that same cryogen layer can freeze or make hair brittle and break. But again, just the outside of the hair follicle itself is still intact. So again, hair will grow back if it's growing in the current port wine stain, but in specific areas of port wine stain hypertrophy, where you lose hair density, that is the issue that does not grow back. And now you're asking a question, can we do hair transplants? Well, the short answer is yes. But this is such a specific and individual question. I would prefer to have some photos or a chance to examine you to offer you better advice.
Thank you for that. Zoe has a good question. My 1-year-old daughter has a port wine on her shoulder, down her arm, her foot, and they haven't started any treatment. Of course, she's had it since birth, but should we be doing laser now at age 1?
At age 1, absolutely. It's never too late to start early treatment on a child with port wine stains. The only issue is, a child that's 3 months old is going to hold still a lot easier than a child who's 1 year of age. The other thing is when you get to 1 year of age, you have to consider the area you are going to treat in the office setting, which may or may not be of the parent's comfort or the doctor's comfort to be able to do a large area of treatment. Sometimes for patient comfort, we won't treat the entire area. We'll treat the most visible area first and work to other areas at different times. Typically, I like to say the palm of the hand is an appropriate area to treat in the office on a child that may cause some pain or discomfort, but not an extensive amount. And what I mean by that is I would not want to hold a child down for several minutes to give laser, even though it's just a rubber band snap. It does cause some snapping or pain, but I would be willing to do it for up to 30 seconds. I would not want to do it much longer than that while a child was awake. If there's such a large area, I guess, again, I have, I'm a surgeon, I have OR time. I just honestly bring those children in, like we talked earlier, a little mask anesthesia, puts them to sleep for 5 to 10 minutes, allows us to treat the entire area completely without pain. They wake up in no pain whatsoever. We return them sleeping back to their parents' arms so that, the child never knows anything really happened. That's a safe way to treat, an effective way to treat large areas of port wine stain.
Thank you for that. 𝗚𝗿𝗲𝗃𝗁 said, Dr. Levitin, warm greetings to you from Lebanon. I would like to express my sincere appreciation for you.
Thank you very much.
Lots of people saying hi, Tamara, Zoe. So the one woman that talked to you said her daughter was diagnosed with the one with the arm and leg staining, CMTC, so 𝗬𝗏𝗃𝗁, and just got diagnosed with TCS2, I guess, which is the new
genetic.
marker.
So I would say, so CTMC we refer to for genetic subtyping because that's a blanket diagnosis, but there are some targeted gene therapies. Certain medications are now more effective for certain genetic subtypes of certain vascular malformations, things that we weren't able to treat effectively in the past. I highly encourage that family to meet with a vascular birthmarks clinic. to talk about different types of therapy. 𝗬𝗓𝗃, again, is oftentimes like a marbled appearance, sometimes has dilated vascular channels, sometimes lymphatic channels. Again, so individual, so different. I'd love to, just see some photos. If I could offer some further advice, I'd be happy to share that.
Thank you. Mary from Ireland says hello. She has a 9-year-old son and he has a large port wine with overgrowth. He had, and from his lower back all the way down to his left side to the sole of his foot. She's been told that the laser will not work on extremities. Is this correct? And it does sound like KTS, so maybe he needs to be worked up.
Well, that's the question: is
Yeah.
Is port wine stain part of a larger malformation? So KTS is a type of vascular malformation that includes port wine stain on the extremities, but also either tissue overgrowth, but even rarely sometimes tissue less growth. It can sometimes be atrophic. I think is the word.
Hypertrophy versus
atrophy.
Hypertrophy.
Atrophy. That's
atrophy. Right.
But that's a diagnosis that needs to be made by a birthmark specialist. And yes, in general, extremities that involve the entire lower extremity are very difficult to treat. They're not great laser treatments because it's just very hard to get an effective treatment without 15, 20 lasers, which only sometimes can reduce color by 50% or more, unless we catch them as an infant. Again, when we're at infancy, we're talking about a different thing than with an adult. But also, again, I would also encourage you, if there is a vascular malformation, to consider genetic subtyping, because there are medications that reduce angiogenesis, things that reduce progression, the things that help to control the vascular malformation, keep it in check. That's, again, something that would need to be discussed on an individual basis.
Okay. Another one pretty much similar. This is from Brian. Our 9-month-old daughter Haley has KTS and has completed sclerotherapy treatments on the small individual spots scattered throughout her body, but we have been told that our options are limited on her main malformation, which stretches from her hip to her ankle, port wine, with major blebs, and she's only 9 months old.
Yeah.
We are on oral 𝗟𝗲𝗏 and are planning on moving the V-joist, which I've been hearing a lot about.
Right.
Should we think about laser treatments as well? We have a relationship with Dr. Stuart Nelson in Irvine.
Yes, so any area in your vascular malformation that's blebbing, causing outgrowth, is usually a venous outgrowth, and a YAG laser can be very effective when you see these very dark black circles within the malformation. I'm also, as your child grows, compression therapy becomes part of the therapy for KTS. There's also some counseling regarding, aspirin for blood thinning, just for risk of DVTs. Again, these are, chronic disease management type things that you should educate yourself with. But yes, if there are blebs, and usually what we describe in KTS blebs, the dark black circles within the mixed lymphovenous malformation, they are prone to bleeding. And it can be very, even in a young child or an adolescent child riding a bike or any kind of, sports can cause chafing injuries that cause bleeding in these extremities. So it's important not just to look at the red stain, but also the small petechiae or black spots are early signs of blebbing or venous dilations that YAG laser at 3 millimeters can just take away. It's really effective.
Thank you for that. The one young woman where we were just speaking about her son and said he should get checked for KTS, Mary, she said he's had MRIs and they've been told it's not. That's common, and it can either be misdiagnosis, or we do see some that are just port wines with overgrowth.
Yes,
and not KTS.
Port wine stain causes increased growth of all the involved tissues. So when we see it's most noticeable often in the face. So I would say port wine stain is not just the stain, it's the skin, the fat, the muscle, even the bone. Even the teeth sometimes are slanted because of the bony overgrowths. And that's not KTS. That's just the condition of port wine stain, which involves all these different layers. Now, specifically KTS should not, the overgrowth is not just due to the port wine stain. It's due to the underlying malformation, which is, again, a mixed lymphovenous malformation that causes invasion into the tissues. And she correctly identified that an MRI identifies the deep tissue components and can identify whether there's any vascular malformation involvement. So that's encouraging that there's nothing seen on the MRI at this time. Sometimes they do show up much later because, again, the growth of the child or the patient can take different stages, adolescent and puberty and things like that. So don't ignore it, but if things continue to progress, every 3 to 5 years, another MRI may be indicated to see if anything has changed.
Thank you for that. Just an interesting side note, I just referred one of the patients that reached out to VBF to Dr. 𝗟𝗏𝗃𝗏𝗃, the OB/GYN vascular anomalies expert from NYU, because she has a massive facial venous malformation. It's in her airway and her tongue, and she wants to have a natural childbirth. But I started worrying about her bearing down and what that might do and obstructing her airway.
What Dr. Linda's referring to is, a venous malformation is dilated veins, but they're not connected to the common veins of our anatomy. They're collected externally and they drain through the system. What Dr. Linda's saying is when you give birth, or if you're through a natural delivery, you're bearing down and grunting or putting what's called a 𝗟𝗲𝗃𝗶𝗁 maneuver. If you're doing that over many minutes and hours, that could cause increased backflow into an airway and cause temporary difficulty with airway management. And if she needed to convert to a C-section, it may not be as comfortable for a team of anesthesiologists to control the airway. I think she should have a relationship with a good ENT airway specialist who communicates to the OB so they can document what the potential risk is to her airway. I think sometimes she can actually, practice, her exercises and breathing exercises before the pregnancy, which allows release of that breathing. It's a pressure but also release so that she doesn't get this backed up Valsalva maneuver. But I wish her a lot of joy and a lot of luck in pregnancy, and I think that's very I would encourage her to seek that out in natural childbirth, but using the advice of your doctors.
Well, one of the beauties of VBF is that Dr. 𝗟𝗏𝗃𝗏𝗃 actually spoke to her doctor in India and counseled him on managing it. And look at that service. Is that incredible? They would reach me from India. I'd reach Dr. 𝗟𝗏𝗃𝗏𝗃 in New York, and he would communicate with her doctor, her OB/GYN back in India.
VBF is international now.
Yep, we are.
21st century.
So Zoe wants to know what treatments are available for overgrowth from a port wine with overgrowth.
Well, again, a lot of times debulking procedures, which basically is a fancy way of saying that we try to remove the excess tissue to restore symmetry, balance, and anatomical landmarks. In the head and neck area, we see a lot of distortion of the lips and the nose and the cheeks, but there's a lot of cosmetic incisions, meaning that we do incisions that hide behind the ear or in front of around the smile lines. Anything we can do to kind of move things back in balance so that you have nice symmetry, good communication. Everyone has to want to be able to present themselves in ideally in a normal appearing way. And so when things are off in any way, we want to help improve that. There are, like I said, on the Vascular Birthmark Foundation's website, there's several of us who focus on this throughout the country, and you're always welcome to reach out to me through my email and send me photos. And I give advice to anyone, anywhere, and willing to even talk to your doctors as well. Like I said, I'm happy to offer my advice.
Thank you. And again, our staff is on, Jim Kelly and Kiana Smith, and they're posting Dr. Levitin's email that you can write to through Birthmark Care or through the VBF. But they're there, so if you're looking, go back and scroll. This video will be on our Facebook page for 30 days. If you want to go back and rewatch anything, and then it will be on our YouTube channel, which the button is right on our website at birthmark.org. So Alyssa has a question. Her 6-year-old has port wine on both sides of his face, bilateral. We did 4 to 5 post-dilasia treatments between 8 months and 1 year, which is bravo, Mom, that's amazing. They look okay, but how do I know when to go back?
Well, a picture tells the whole story, so I'd like to see what looks okay to you, but what I really want to do is encourage people to understand that there's not a set number of lasers that you have to do for port wine stains. I would say that every case is an individual case that we address individually. That may require 3 to 4 treatments, it may require 10 to 14 treatments over a period of 2 or 3 years. So I would encourage you not only to start early treatment, but continue with your laser treatment, not just for maintenance, but also to see if you can change the settings. Sometimes people get frustrated when they have done 4 or 5 treatments and it didn't work. Sometimes if we change the spot size to something smaller, or if we add another jewel to the settings, I always say people bake cookies at all different temperatures. And so you sometimes have to find that, there's always a safe range, but you have to adjust yourself along that range. And I find that a lot of people, when they change from one treatment center to another, you're changing your treatment parameters. So again, sometimes I've seen patients who've had multiple treatments from another place, but if we just change a couple little settings. Sometimes we can kind of build off of what they've already accomplished and get even better results. So never stop looking for treatment.
Amen. Interesting case that I need to bring your attention. You know the patient. He had a lymphatic malformation in the orbit. He's in his early 20s now. And he has a big scar right by his temple from his surgeries. And he wants to know if he can get a hair transplant.
Absolutely, but that's such a specific question, and I know exactly what you're talking about.
Yes, I know.
So I've
you
known him
would.
since he was a small boy.
I know.
He should reach out to me because I actually have friends that I've worked with this on a couple other patients. Occasionally, really what we're talking about is like lymphatic malformations are locally invasive, so they destroy some of the tissue. And so, this very wonderful young man who surprised me at one of your VBF conferences, who I hadn't seen in like 10 years, which really surprised me. Wore a name tag of a patient that I knew when he was like 5. And so seeing him at 15 or 16 was a surprise. So if he's watching now, you know my email. You should reach out to me, send me some updated photos. But yes, I'd be glad to discuss with you a couple good options. Hair transplants is one thing, but also tissue expanders are another. Either way, you're
I was
talking about.
thinking of that, like closing it up, or
So it just depends upon where the regular
Yeah.
skin and the hair skin begin, and so whether we're pulling tissue forward or bringing new hair into that area. It's something we just again.
I'm gonna give him your email when I get on the
Please
train
do.
on the way home, so
Yep.
he can directly write to you.
Please.
So I'll be very happy to hear from you.
I'll be-
I knew you would have a good response. Kyla says, my almost 4-year-old has 𝗂𝗃𝗃 without KMP, so Kaposi form of hemangioma without 𝗓𝗃𝗃𝗃 phenomenon. It was diagnosed very late, took about 2 years. But God bless that you got it diagnosed, because more than 50% never get it right. So you have a good team that got it right. We're going on a year without tumor growth. That's a miracle. Been gone after using 𝗟𝗏. He has an MRI in 2 weeks to see if there's any new growth, but we are hopeful that it'll be clear. My question is, I'm currently pregnant with our second, and we meet with a genetic counselor tomorrow. Could the 𝗂𝗃𝗃 have been caught on an ultrasound scan? I think she meant during pregnancy.
during pregnancy.
Is there anything more I can do to help our future child to make sure that they don't have 𝗂𝗃𝗃?
So, I'm not familiar with the genetics of 𝗂𝗃𝗃, but 𝗂𝗃𝗃 is a type of vascular tumor that traps platelets. So, in a child that's born with this, so it's usually a fully formed tumor, it looks vascular, sometimes misdiagnosed as a hemangioma or a fully formed hemangioma, but it's actually potentially life-threatening in the way that can trap platelets and cause major issues. There are lots of treatments that are implemented for these children. It's evolved over 20 years. There are specialists on the VBF website that can certainly address these much better than what we can on this forum. But I would say the answer is yes. You want to be evaluated by a specialist. You want to talk to them about any genetic potential. I'm not aware of any genetics underlying 𝗂𝗃𝗃. But as far as tumor management, if you do not have thrombocytopenia or low platelets, and you're just talking about it, I don't know where this tumor is on the body, you can start to consider surgical debulking, and they can be safely removed to restore normal anatomy and things like that.
That's a great answer.
I
And
want to ask one question. Was there a Spanish? I speak Spanish if there was.
yes,
It just
I
came
know
up.
you do.
Yeah.
It came up?
I saw someone about born maybe 3 months old.
Well, I
right
might
before
not have
that.
gotten there.
Oh yeah, Marta de Nacenza, 3 out of 4 treatments. Well, that's what it was.
Yeah.
It wasn't a full question. So.
Okay, there was another, about the 𝗂𝗃𝗃, just for Kylie's peace of mind. So we've networked 150,000 into treatment in 31 years.
Take a moment. 150,000 patients were children who were born who didn't know anything about the birthmark and found the VBF, and through the VBF found treatment. That's really
But more
special.
important is I get 50 to 100 new inquiries a week. And this has been going on for 30 years, and I've never once seen a subsequent 𝗂𝗃𝗃 case in a second or third subsequent birth. I've only seen it occur once in a family. So that's some.
Well, they are.
Relief.
They're considered random events, not genetic predisposition. So not only is that child's siblings not likely to have a 𝗂𝗃𝗃, that child's also not likely to pass it on to their children in the future.
So Irma says, hello, Dr. Levitin. My daughter is now 17. She was diagnosed with hemangioma with lymphatic malformation. Okay. when she was born. She's had surgery when she was 1 year old and had treatment with 𝗚𝗿𝗲𝗃 injection when she was 9 years old. She's now 17 and has venous lymphatic malformation, likely a mixed lymphovenous malformation
Correct.
all along,
Yep.
and the bottom of her lip and tongue. What are your recommendations? This would be a beautiful one for you to see, Case.
Yeah, I say please email me your photos because it really depends upon, you know, are we dealing with a small problem, a big problem. I would say take out the hemangioma diagnosis. A lot of times when children are born with any vascular lesion, they're just told they have a hemangioma, but then of course, you know, it's not a hemangioma. So, you know, 50% of cases are often misdiagnosed at birth, but, you know, time is part of the learning curve, meaning that as a child grows from 1 month, 2 months, 3 months, we can start to see changes or even, again, referral to a birthmark specialist that can actually confirm the diagnosis. So important to confirm a diagnosis because treatments are not the same depending upon the diagnosis. So getting the diagnosis correct opens up the entire support network of not only, you know, establishing the diagnosis and meeting with other families and of course, you know, communities on VBF, but also is ensuring that you're getting the correct treatment and not wasting time on unnecessary treatments.
Thank you for that. I also want to give a shout out to Missy Scott, our 20-year-plus web mistress, webmaster, because she's got all of the accessibility and everybody's able to read all your answers and it texts out what you're saying. And I just love that we have that, so that's always there. I'm just saying this technology has improved so much with what we've been doing. Okay, so my son is 4 and his port wine stain goes over his eyelid. Do you often see the eyelid getting thicker with the port wine? He has had 9 laser treatments on his forehead, but only 2 on his eyelid.
So I'm going to say this is a great example. Just stop for a moment and talk about the distribution of port wine stains. She mentioned the forehead and the eyelid, which is different than the cheek and the chin. And what we're talking about is whether there's any relationship to 𝗟𝗃𝗏𝗃 syndrome. So areas of port wine stain that involve the eyelid or around the eye or the forehead is called the V1 distribution. V2 is across the cheek, and then V3 across the neck and the jaw. So V1 distributions, again, forehead and upper eyelids have the potential, not necessarily always, but sometimes the potential to have a deeper involvement. We talked about glaucoma. We talked about seizures. These are all things that potentially involve 𝗟𝗃𝗏𝗃 syndrome. And I think that an MRI is very important to rule that out very early on. And of course, VBF has its own expert for 𝗟𝗃𝗏𝗃, and so people can log on and join a community where you get a lot of education, and that's very important. But the short answer is I do believe you should treat this with laser. I did explain earlier that it needs to be done safely around the eyelids with a eyelid shield that can only be done with numbing drops. If it's a small baby, it can be held still. You can do it in infancy, but once they get to be several months or several years of age, I think it's much safer just to do a mask anesthesia. It literally takes minutes. It's very safe. It's the same thing, the type of anesthesia when we put ear tubes in children, just they go to sleep for a few minutes to allow us to do that safely. But it's very important, again, early treatment at these younger ages can really diminish the progression, slow it down, sometimes even hold it in check for a long time.
Thank you for that. In response to 2 different people who mentioned the same thing, I wanted you to address that an MRI reading is only as good as the person's knowledge of vascular anomalies. So if in fact it appears to be something like KTS with the overgrowth, and they say, oh, the MRI was read and they said they don't have it, we offer to allow a free second opinion. We have Dr. Nasseri and Dr. Rosen who reviews those images through VBF, because it can happen that they're told, no, you don't, and they do.
Well, I think, and they're also only as good as the information they're given. So, meaning when someone orders an MRI, we want to talk about, we want to, evaluate for potential 𝗟𝗃𝗏𝗃 syndrome. That should tell a neuroradiologist, who's a specialist who reads MRI scans. So, look for even the smallest, indications, of vascular malformation inside the meninges of the brain. The point being is that sometimes also. Sometimes people get MRIs in the first 6 months of age, but the vessels have not developed enough to show up. So the difference between 6 months and 2 years could show something very different. So we tend not to do MRIs in the first 6 months of age, but actually afterwards, because I've found sometimes that we've had negative MRIs in the first infancy, but then they do show up positive later on in life. So it's important to not only evaluate it, but repeatedly reevaluate things, especially when there's signs or symptoms of anything like that. Also, I've seen people who have gotten glaucoma checks when they were very, very young and told, oh, you don't have glaucoma, and they just set it and forget it. But in fact, I say wait 3 to 6 months, go back again, go back at 1 year. Always, once you've had a serial examination where a doctor's had more than one chance, I always say, a snapshot window of today may be a good day, but another day may show a different sign or progression. So it's important to go back to the same specialist. Again, understanding that, as Dr. Linda said, what are we looking for? We're looking for any signs of glaucoma, any signs of asymmetry of one eye to the other, any signs of, in these MRIs of anything lighting up and showing intracranial involvement, anything that, can be suggestive of that, so that we know who we want to follow closely and who we can, step back.
Thank you. This is a very interesting question. Melinda says her 27-year-old daughter has a port wine on her face. She's had 15 laser treatments and she's pregnant, and her first child, and the cord has attached to the placenta in a horizontal position instead of normal going vertical. Do you know if the cord position to the placenta has ever been looked at for increasing chances of a port wine? The reason I say it's interesting because we had done a maternal study and found not that, but like there were some relationships with placenta and cord and hypertension, as you know, like high blood pressure during pregnancy.
So I would actually say that, I would refer this as a potential high-risk pregnancy because of placental abnormalities, which I actually think has a more increased chance of having a child born with a hemangioma. So I don't believe that the port wine stain would be related to this, because the port wine stain pathology is really because the nerves did not develop connections to the veins. So the nerves tell the veins how big to grow or how small to stay. It's called vasoconstriction type things. But if you lose that neural input, then the veins don't have any parents in the room to tell them what to do. They just grow slowly and dilate over time, and that's the pathology of port wine stains. Hemangiomas, as we know, potentially are related to high-risk pregnancies, multiple gestation, low birth weight, preeclampsia, placental abnormalities, things like that. But two very different pathways. I would say that you're asking questions, I think, because you have a port wine stain, but I don't think that there's any greater risk for your child because of the placenta.
Well, this is so fascinating because her mom wrote again. So she has a port wine.
Mm-hmm.
Her husband's brother has a port wine, which is a 𝗔𝗍𝗃, which is somatic, not germline. So it's a 0.03 random occurrence occurring twice, right?
But her husband's brother.
Her
so
husband's
not
brother, right?
bloodline.
No bloodline, and
Right.
it's somatic. But I just found that fascinating that she wrote that because it still doesn't increase the chance. But it's kind of cool. That party's like, oh, I got one.
Yeah. I'll show you yours if you show me mine.
Yeah. Madison says, thank you. I don't think any doctors here do the mask anesthesia.
So sometimes you need to travel to a university hospital where there's a pediatric ENT or a pediatric dermatologist that has OR time that can do this. I know at my hospital there's 1 or 2 dermatologists that do come like once a month to do those cases. Of course I do my own cases, and you're welcome. I accept all insurances, so if that's what it takes to get treatment once or twice, you're welcome to come visit me, or again, any of the specialists at the VBF website might be appropriately, closer to you. Please reach out to one of them.
Question about your new location and your new practice. Are you doing any procedures here locally in your new office?
Well, I'd say 80% of the laser treatments we do here in the office.
That's amazing.
We have a pulse dye laser here, and that's, again, we cut, as an in-network physician, sometimes it takes us a little bit of effort to get the insurances on board, but I'd say we have like a 95% opportunity to do in-network treatments for laser, which I think is very important. These are children, these are not cosmetic procedures, so it's really important to explain to insurance companies that these are not cosmetic procedures. These are not parents who are trying to make their children anything more than just restore or reconstruct what is growing out of proportion. So I spend a lot of time on the phone with insurance companies. But no, the opportunity to, again, intervene in the first, weeks of life, for these small children with hemangiomas and port wine stains, I think that's the beauty of VBF. You can live anywhere in the world and go on their website to find a doctor, and there should be someone relatively close to you that should be able to provide these kind of services. Certainly at my office, like I said, that's why we dedicate an entire room to the for pediatric laser treatments and adults, as well. Because it's just so, if you have to wait till you have OR time, it could delay things for 3-6 weeks, if you're busy or if there's a holiday coming up, things like that. So a lot of us, like I said, who are in the world of birthmarks are, finding, creative ways to, bring treatment as early as possible.
So in your office setting, you can do the laser and you use the eye shield.
Yes.
Right.
Yep.
And then what about any small blebs? Can you treat them here, or do they have to go for OR?
Yeah, so very small lesions we can remove,
Okay,
because we do
good.
small soft tissue. I'm an ear, nose, and throat doctor, so I do a lot of small procedures in the office already. But anything that has either a high risk of bleeding or it's more extensive, where we're doing 3, 4, or 5, the OR equipment is just so much better as a reconstructive surgeon. We want plastic surgery closure, so a lot of times it's all about the equipment that you have in your office, and also providing the best care possible.
Okay, thank you. The question is, gliomycin toxic? Could it have secondary effects after using it to treat AVMs? I know there's a life limit on the volume.
Yeah.
That's the only thing.
So, bleomycin's been around for a long time, and when it was really originally used as a chemotherapeutic agent, it had a high dose usage because it was treating cancer. The degree that we use bleomycin in vascular malformations is not even a quarter or a tenth. It's much less than that. There is a lifetime dose that we follow with our patients because of the potential for pulmonary fibrosis with higher lifetime doses. Not a single dose, but accumulated doses. And again, we found this out when we were treating patients for cancer because it was a very effective chemotherapeutic agent. In the smallest doses, using 10 milligrams or 15 milligrams, we want to keep your lifetime dosage below 400 milligrams. And so if you're treating, 3 or 4, even 5 treatments, you're talking about 50 or 60 milligrams, which is not even a quarter of what you're allowed to have in your lifetime. And there are so many other chemotherapeutic agents that are out there that even if you, God forbid, 20, 30, 40 years later needed treatment, they could potentially use alternate, medications that would not double down or rely on just that single, class of medication. But it is an important medication with safety parameters, with usage parameters. We have adhesive restrictions when we use bleomycin to prevent dermal staining, because sometimes adhesion can actually cause pigmentation during the initial treatment. But it is very safe to treat with bleomycin, especially in areas that are hard to reach, areas that are around nerves, especially in the face or the body. So again, these are things that, have to be individually discussed with your doctor, but I would not want to fear a medication that has provided such effective treatment to a lot of our patients.
Thank you for that. Oh, quick answer for Melinda. All of these sessions, and to everyone that's on this live with Dr. Levitin, you can rewatch as soon as we're done in 15 minutes. It will be posted to our Facebook page, and you can re-listen to everything he said. It'll be there for 30 days, and then on our website at birthmark.org, if you click on the little YouTube icon at the top, you'll not only see this session with Dr. Levitin, but you'll see all of his sessions from back till 2017 if you want to listen to them. But we keep all of our Facebook Lives. Since I started this January 1st of 2017, we have over 100, and they're all on there with Dr. 𝗚𝗏𝗃, Dr. Levitin, Dr. 𝗔𝗯𝗔𝗻, and Dr. Nelson. So I encourage you all to go back and rewatch this if you're unsure about some of the things that Dr. Levitin said. So yes, they are recorded and they are indefinitely out there for you to rewatch. Courtney Jacobs has a question for you. I have a 3-year-old with an eyelid hemangioma. It's not affecting her vision anymore. We've been advised to wait on surgery until she's older. Would you agree with that?
So I would say this becomes one of those areas of controversy. When do we operate and when should we operate? And I would say that it's important, especially for eyelids, to be evaluated at the earliest stage possible, because hemangiomas that involve the eyelid can put pressure on the eye and cause vision changes through a process called astigmatism. Now, you mentioned that there's no vision changes, so that's a relief, because if you don't restore vision at an early age, vision doesn't get better if you treat it 3 years later. That's why these are one of these early emergencies. However, I believe that a child deserves to look normal and be brought up in an environment where people are not looking at it in an unusual or a negative way. I think if you can tell at age 1, 2, or 3 that this is something that's going to eventually need surgery, the important thing I think is to find a specialist who can treat it effectively, safely, but I would actually recommend that you do it as early as possible. I find that earlier surgery, not only is it safe, but it can often be more effective and it can help restore normal anatomy so that the child develops with normal anatomy. The child has an abnormal change to the muscle or the skin and it's not treated and the child grows with the rest of the body growing normally, but it grows abnormally or doesn't grow at all. Well, now not only are you trying to remove hemangioma, but now you're trying to restore an abnormality that was acquired from delay in treatment. So I've seen that before as well, where the treatment actually was delayed, but then not only did we have to remove the hemangioma, we had to reconstruct the area that did not develop properly. The eyelids are such a critical area, and the lips and the nose are also other areas that are so critical that you have to be very specific and intentional in how you approach it. You need to be very sure that you're reducing risk at all times, because as much as surgery is predictable with the way we want it to go, there are things like infection and bleeding, and a child can touch an eye or open a stitch. We always want to make sure that we're providing the safest and most effective treatments. But I would argue, and again, this is after 20 years of experience, that earlier intervention is much more effective than delayed. It used to be 20 years ago that we said, oh, wait till they go to be ready for school and then we would operate on those children. But fortunately, the doctors who came before me pioneered the early intervention, first at, before school age, then before age 2. And now we're treating patients as early in the 9, 10, 11, 12 months of age, who not only are we saving vision because of those early hemangiomas, but we're also restoring them back to normal appearance. And a child's psychosocial development, this is taking a page out of your book, a child develops a sense of self between age 2 and 2.5. So when you're able to treat a child and restore normal appearance before then, they don't have an appreciation that people see them as different. But after age 2.5, they can look in the mirror and they can appreciate the way people look at them as different, and oftentimes that's a negative thing. People often look at them with a curiosity or even a negative, like, what's wrong kind of look. And no one wants to be looked at that way. Certainly not a child, not a developing child, not an impressionable child. And I think it's very important for the integrity of that child's whole person to give them the best opportunity to restore that to normal.
That's a great answer, thank you. Kaylee says, hi from Melbourne, originally from South Africa, so 2 continents. I'm 39 years of age and had to have several treatments several years ago. I'm assuming it's a port wine, but I don't know for sure. Yeah. She said, I'll send you an email with photos, would love your opinion, appreciate your time.
That's how, I also get 50 emails a week sometimes. So.
Yeah, at least, I'm sure. Kathleen would like to know, I'm 57 with a port wine on my chest and right hand, and have noticed thickness in both of these. Is this something the laser would treat? I don't care about the look, just the increase in thickness with new blebs. Yeah,
so this is, again, one of those things that, you're 50-something years old, that's oftentimes where you sometimes see the first signs of blebs. And so what you really want to do is, those tend not to get better, they tend to get worse, but again, slowly. It'd be ideal to meet you in person to examine you, or at least have you see a plastic surgeon or a birthmark specialist who can evaluate that. As you said, you've grown 50-something years old with the port wine stain. We're not going to cure the port wine stain, but we do want to remove anything that is not smooth or on the surface, because that can get larger over time. So please email me. I'd be happy to offer you my advice.
Thank you for that. 𝗚𝗲𝗃𝗏 said he's from Bangladesh and there is no advanced treatments for his daughter's current condition. She's having her first exams of high school, and after her exams I'm planning to come and see how I can consult with you.
Sure.
So his email has already been provided. If you just scroll up, you can send him some pictures so he can get a good handle on it. And if you can come to our super clinic in October.
I would say if you're going to come once, come in October. I'd be happy to see you on a Thursday or Friday, but more importantly, you can see 10 or 12 of the world's experts all in one day at the VBF clinic. It's a free clinic. And it's something that, again, we would encourage anyone who has either been misdiagnosed or not properly diagnosed or not given treatment options to come to the clinic, where we can at least provide important and helpful information.
Thank you for that. Alicia wants to know, is Dr. Coletti have a talk this year? Yes, and so is Dr. Levitin. So your 2 favorite doctors will both be giving talks this year. We have 6 minutes left, Dr. Levitin. It's been an amazing session. Let me see if I missed any. Yes, oh, I got some more. Do you use the mask anesthesia if using the new candela? Oh, she means the Pro.
The Candela
On
Pro.
a 2-year-old for a hemangioma. It's on half of his face, his chest. You don't have the Pro yet, right?
So don't have the Pro yet. In fact, it's only been released in only a few places, that have had access to it. Again, it's a different. It's similar technology, but it adds on the YAG laser in addition to that. So it's a more versatile laser, especially for perhaps a clinic that only has one laser. That would be probably the best laser because I'd say 80% of what we treat is the port wine stains and the hemangiomas with the pulsed laser. But again, deeper lesions like venous malformations or blebs need to be treated with a YAG laser. So it's really for those kind of things as well. But yes, mask anesthesia, whether it be the Candela Perfecta, which is the current model, or the Pro, for a child with eyelids, would most likely be done with mask anesthesia.
Let me ask you this question because I'm learning new things like I always do from you. Comparing a hemangioma in like a 2-year-old that's done growing and a port wine stain in a 2-year-old that's never been treated. Do you treat those differently? Are you more aggressive with the hemangiomas because they're bulkier, or do you treat it the same as you would a port wine?
Wow, talking about saving the hardest ones for last.
I did.
So I think again, I will defer by saying is if they look similar, I'm going to treat them similarly. Meaning that sometimes port wine stains and hemangiomas can be confusing to all of us at birth, and then hemangiomas tend to progress very quickly and grow deep, darker and thicker, whereas port wine stains are again these slowly progressing things that tend to darken slowly. So we have more time, or the luxury of time, to implement laser treatment for port wine stains in the first 2 years of life, but whereas hemangiomas, we're trying to push that laser in the first few months of life because we want to get ahead of it, not wait until it's too much bigger. Now, at the same time, hemangiomas that thicken as they grow, the laser is only effective on the superficial component. It only treats the top layer. So when we have hemangiomas that show up as flat lesions, that's the ideal time to do a laser. Once the hemangioma becomes thicker, where you're talking about the top and the bottom layer, sometimes we're talking about a combination of tissue debulking, which is surgical to make a flat lesion, and then adding an extra layer of laser afterwards to restore the skin to a normal appearance. Again, I don't know that we're talking apples to apples, but
Right. I guess I was thinking too, like if you have a.
But settings-wise, yes, the settings would be very similar.
Yeah. So if you have like a 4-year-old girl and she had a fairly bulky, like 7-8 millimeter off the skin infantile hemangioma, would you put her under anesthesia and be aggressive, or would you just do repeated light lasering to see if it would put it into involution more?
So 7 or 8 millimeter, I think you mean centimeter, larger. Exactly. For others for Dr. 𝗟𝗏𝗃𝗏.
I tried.
So, but yeah, 7 or 8 centimeter is actually just large enough to be within the size of the palm of the hand.
Right.
So I'd say it's large enough to need treatment, but still be effectively done in the office without, again, being unfair to the child's experience. But yes, I would be treating these as early as possible, as often as we safely can, every 4 to 6 weeks. Sometimes as early as 2 or 3 weeks if it's an aggressive hemangioma. And yes, we would treat those in the office setting as long as we possibly can, as long as we're meeting the needs of the patient, the safety parameters, and the comfort of the patient and the family.
Thank you for that. So as we wrap up, I would like to remind all of you, if you would like to see Dr. Levitin in person at our conference, please register soon because all the hotel rooms are going to be gone. I realize we're just bordering on May, but we have a lot of interest this year, especially with the new lasers and new doctors coming on board. So you
and new services.
Yeah, new services with the glaucoma check. So, and we have the bedazzling this year with Paige.
I saw your email that went out this week.
Yes,
That's
with the bedazzling.
It's really impressive.
And the children's book reading that we offer, so that's all great. So it's go to birthmark.org and you'll see the free clinics. We do still have openings for Italy, so all of our international patients that are on right now, if you can make it to Milan, Italy on June 6th, Dr. 𝗟𝗏𝗃𝗏 is doing free laser, Dr. Nelson's going to be there, and Dr. 𝗟𝗏𝗃𝗏 doing 𝗟𝗏𝗃𝗶𝗁 evaluations. We still have openings for that. I will be in DC this Friday for our free clinic. And yes, we can squeeze in 1 or 2 more patients if you're in the area. But most important is the only time we give out free lodging, and you get to hear the talks in person by all these world-renowned experts, is our October clinic. So make sure you register. Don't wait, because we will have to do a cutoff, which we've been doing only because we can only handle just so many patients. We've never had to cut off until last year, when we started literally like getting the biggest clinics we've ever had in our history. So take time. We do have one more question.
I saw that. That's my.
Is that your friend?
That's my little brother from another mother. I've been treating this.
𝗚𝗏𝗃𝗁𝗃𝗏?
Yes, he's a identical twin. So
To you?
Well, no, I have identical twin girls.
Oh, that's right.
But he.
And I'm a twin,
I'm
and
also
you're
a
a twin,
yeah.
and you had twins.
Yeah.
So we're twinning.
Yeah.
Okay.
Could be.
Can't thank you enough for everything you've done. So that's
My pleasure.
It's a wonderful way to
Thanks for
end,
joining us today.
end
That
the
puts a smile on
day.
my face. So.
Thank you all. God bless. Stay healthy. And remember, May is our month of awareness. And don't forget to put on your
Birthmark.
Thank you.